So we are continuing our CDM session for the QE1 and step 2 and step 3 with the rest of the stuff that we were discussing. So we're discussing about the dose of epinephrine anaphylaxis, and what did you say? The concentration is 1/1000. 1/1000. The route of administration is IM. The whole vial is 1 cc, 1 milligram, right? So they give half a cc. How many milligrams did you give to the patient? Half a milligram. So if you give half of the vial, you give 0.5 milligram of that. You want to forget everything? That's fine. 1 milligram. Most of the CPR medications, most of the resuscitation medications are 1 milligram. Epinephrine, 1 milligram. Atropine, we used to use it a lot, right? Atropine, we used to use it a lot. If you have done ACLS recertification or certification in the last 10 years or 8 years, atropine, we don't use it unless for symptomatic bradycardia. Symptomatic bradycardia. We used to use atropine, epinephrine, epinephrine. For what? For asystole. Remember? Asystole. My generation doctors remember. Epi-atro, right? With one of them we push the gas pedal. With the other one we actually put our foot from the brake pedal, right? Epi-atro. But multiple studies show not that much survival benefits or increasing survival. So we use epi. We don't use atropine anymore in the CPR unless for symptomatic bradycardia. That's it. Yes. Nothing? I thought you had a question. So this was the vial. So 1 cc, 1 milligram. IM, the concentration 1/1000. Half a milligram to 1 gram. Half a cc to 1 cc. But half makes your memory crazy. It kills you, right? So just remember 1 milligram, 1 cc. IM, 1/1000. That's it. About the colorectal, we'll talk about it tomorrow. Don't worry about it. Ontario and Toronto must have something else. That's fine. That's okay. Most of the books are not okay with that, but we'll talk about it maybe tomorrow. Not definitely for tomorrow. Somebody asked me about the PID and pregnancy. PID and pregnancy, CDC guidelines, right? Combination therapy, as you can see here. Dr. Marjan, Dr. Habiba, Dr. Arzu, and Dr. Pregash. Combination therapy with ceftriaxone and a macrolide, both pregnancy category B, is reasonable alternative. It would be IV, and it would be combination of ceftriaxone, third generation cephalosporin, plus a macrolide. Azithromycin? Why not? If you're in doubt which macrolide to use, always azithromycin is good. Because azithromycin is not too many contraindications. Azithromycin is safe in pregnancy, right? So azithromycin, always macrolide, you don't know what to use azithromycin. Shorter course of treatment, and also it is safe. Make sense? Does it make sense? Yes. So PID treatment here, ceftriaxone and a macrolide. IV.
IV?
Yes, of course. If you're admitting the patient, any PID that you admit, give them IV. Do we have oral ceftriaxone? No. We don't. We have cefixime. Third generation oral is cefixime. Right? Cefixime is third generation, which is oral. Make sense? Good? Any unresolved issue from the past? We're all in peace? Can we go on? Okay. We'll continue till 9 o'clock. Yes. So, anaphylaxis, we talked about it. And the beautiful part. Animation, current slide. And let's go. Good. You have color, right? Is it colored or not colored? Inshallah, the restart will solve the problem. Yes. Let's send some magic to the camera.